Good morning, Kahnawà, and thank you for joining us this morning on a early version of Facebook Live and a public health and a public safety update. We're here this morning to give you an update on where the current status, where the community sits in terms of the latest information regarding COVID-19. As you may have seen already, we did put out a press release yesterday that did mention that unfortunately, Kahnawà has declared that we are officially in the fourth wave of the pandemic. That's fallen in line. Unfortunately, what's happening throughout the province and throughout the rest of Canada as well. It's not that it's totally unexpected, but it's certainly still disheartening that after 18 months we're still talking about another wave of COVID-19. We also put out the fact that we do have 15 active cases in the community, and we do have some clusters, and we do have an outbreak that public health is currently dealing with. So, we are certainly not immune to what's happening around us, and so obviously we have to look at the ways moving forward. Today, we're not here to talk specifically about measures, but we're here to talk about where we stand, the latest information, the latest facts, the latest data, so that the community has a snapshot of where we are, and want to speak to you also about some of the principles, the guiding principles, and some of our goals that have been guiding us and will continue to guide us moving forward. Since the beginning, obviously the primary goal is to save lives, right? That's the bottom line if you cut through everything. And to date, we have been successful in doing so. But some of our guiding principles, as we speak today, because it's a scary time. People don't know what's going to happen. You hear fourth wave, and you see what's happening around the world. But obviously, saving lives and preventing people from dying and hospitalization is still the primary goal. But also a principle we're working with is to maintain the economy. We want to make sure that the economy of our community is maintained to the best possible extent. So maintaining the economy is also a principle in which we strongly believe in. Minimize the impacts on mental health. Mental health has been a major concern for the past year because of the longevity of the pandemic. So we know a lot of people are suffering, so we want to ensure that we minimize the impacts on mental health as much as possible. And we want to ensure the education of our children and the physical activity for our youth. We want to ensure that we decrease the isolation of all community members, especially our elders who have been subject to extensive isolation over the past year and have recently felt a little more secure to leave their homes after they were vaccinated. We have to protect our hospital as well as the healthcare systems outside of the community. But it's important to know as well, there is strains on our local hospital as well, and also other frontline workers who have been working through this pandemic throughout. So we have to also use that as a principle to guide us moving forward, and keeping in mind that there are many frontline Kahnawà and other people working for our community who have been doing this for a long time. We want to keep cases and contacts to a minimum. Less contacts equals less cases. And less cases, also equals the fact that there's less chance of people getting sick and less chance of people dying. So a principle is to minimize, those contacts as much as possible, and also using the least amount of measures to achieve the goal. So we want to use the least amount of measures to achieve these goals, and what is the best way forward for our community. And some of our current goals, and they're directly linked to our principles, is that we want to make sure and do it our utmost to ensure that the children remain on-site learning in school for this year. We want to keep businesses open. We want to maintain sports and recreation. We want to maintain gatherings. We want to maintain and keep the residences open, like KMHC, inpatient, Turtlebell Elders Lodge, and ILC, for example. And we want to continue down that path towards a normal state, towards that new normal. We know it's a very crucial situation that we're in, where we are trying to achieve that state of normalcy, but unfortunately, we are also entering a fourth wave. So, but we certainly want to try to find a way forward that would allow for these principles to be supported, the goals to be supported, but also ensure the safety of our community and health of everybody is paramount. So with that, I have Lisa here to present lots of data, information and facts regarding the current situation within the community, as well as the impacts around the community. So with that, once again, good morning. Thank you for joining us, and I'll let Lisa take it from here. Nyawa.
Thank you. We thought it really important to share our guiding principles and the goals that we have in place at the current moment, because this is how we make decisions based on some of these goals and some of the guiding principles that we have. And it may help explain a little bit where we're coming from and the reason behind some of the decisions that we might make in the future and in the near future. So just to give a little bit of a snapshot of where we're at, there's a few things that we're going to cover today. The first that I want to talk about is the Delta variant in particular. So INSPQ, which is, again, the research arm of public health, has come out on August 13th with their most recent data regarding the Delta variant. And I'll just give a little bit of a summary. So what we do know is that the Delta variant is more transmissible. I think we've heard this quite a bit in the media. So the Delta variant is more transmissible, and we're seeing that it's more severe. So what this means is it's associated with a higher risk of hospitalizations, intensive care stays, and death, primarily amongst people who are unvaccinated. And I'll give you a little bit of that data as we move forward. We're also seeing that the Delta variant in people who do get this variant have a higher viral load. That means that they're more contagious. When you are vaccinated, you, yes, can get COVID. We know that. The goal of vaccination is to decrease severe illness, hospitalization, and death. So even amongst people who are vaccinated, we're seeing that with the Delta variant, they do have a higher viral load of this virus. However, when you're vaccinated, the viral load stays for a shorter period of time. So yes, you're as contagious as somebody who's unvaccinated, but you're contagious for a shorter period of time. And that's the data that we're seeing right now. However, when you are vaccinated, you're less likely to get the Delta variant after exposure. And again, we'll look at the data in a few minutes. We're still waiting on further data regarding transmission of the Delta variant in people who are vaccinated. So in particular with respect to asymptomatic transmission. So somebody who is vaccinated who gets COVID-19, Delta variant, how do they transmit if they don't have symptoms? It's still, we're still doing research on that. We'll talk about children for a little bit. So children, we're hearing a lot in the news about children and the level of risk associated with the Delta variant. So the evidence that we have up till now demonstrates that children are more likely to get COVID-19 when it's the Delta variant. So we are not seeing evidence as of yet that they have a higher risk of hospitalization or death than they did with the regular strain of COVID-19. But we're seeing that they're more likely to get COVID-19. They're not as immune as they were with the previous strains. So they're as likely to get COVID-19 when it's the Delta variant as any other person of any age group. And that's the data that we're seeing up till now. So yes, we are seeing that more children are getting COVID-19 when it's linked to the Delta variant. And therefore, it's normal that there are higher hospitalizations for children at this particular time because more kids are getting sick. Also, we know that children are not vaccinated under 13 years old or under 12, and so that's another reason why we're seeing more children getting COVID-19 at this particular time. So as we get more information about the Delta variant, we'll continue to keep you up to date. So I'm going to talk a little bit about data that we're seeing in Quebec in particular. And the statistics that we're seeing. So Montérégie, I'll just talk about the Montérégie sector because that's the region in which that Kahnawà falls. So the cases in the Montérégie area that are related to the Delta variant as of yesterday were 57%. And that's a very gradual, well, that's a very quick actually increase in number of cases related to the Delta variant. And the predictions are that this will continue to increase, and the Delta variant will become the more common strain of the virus in a very short period of time. Hospitalizations are also in the increase daily in the Montérégie area. As of yesterday, there were 119 people hospitalized, and the number of deaths are also increasing. Again, we're seeing this increase slowly. However, we're going to see, the predictions are that we'll see higher increases in a short period of time, as we are seeing number of cases increase quite drastically over the last week or so, and will continue to be exponential. So actually, and if we compare our number of cases yesterday to the exact same day last year, yesterday we had 603 new COVID-19 cases, 57% of those related to the Delta variant, and last year there were 142 new cases on this same date in 2020. The vaccination rates in Quebec as of yesterday were 79.1%. We give this information because it's important, again, in how we make decisions. Remember, there are certain variables that we look at, and the situation around Kahnawà is one of those because it has an impact on the community. So some of the take-home messages: the Delta variant is rising. The percentage of cases related to the Delta variant is rising. We know that the Delta variant is more transmissible, more severe. We actually also know that 2 doses of the vaccine is the most effective against the Delta variant. Again, we'll show evidence of that shortly. And we know that number of deaths are starting to increase as well. And these are all the indications of the beginning of the 4th wave. So let's talk about our statistics in Kahnawà. I'm going to just ask Wanadio to pull up a pie chart. So actually at this particular time, in the 4th wave, so we consider that having started at the end of July, so we're only about 1 month in of the 4th wave, of what we consider the 4th wave in Kahnawà. So in this 4th wave, over the period of the last month, we have had 51 COVID-19 cases. The first group a couple of weeks ago were all related to the Delta variant. We are the last 10 that we have active at the present time. We still don't have information about that. The testing is in the process of being done. So we've had a total of 51 cases, but in the 1st, 2nd, and 3rd wave combined, we had 134 cases. So we already see the severe impact of the Delta variant in the community at this time. We had only 2 hospitalizations during the first, second, and third wave. We've already had 1 hospitalization in the 4th wave. Again, knowing that you're more likely to be hospitalized with the Delta variant, and that's demonstrated, of course, with very small data, but in what we've seen so far. So if you look at this pie chart of the 51 cases, everything you see in red are the 48 people who were not vaccinated. What you see in green are the 2 people who were fully vaccinated, so 2 doses of an mRNA vaccine. And what you see in yellow is the 1 person who had 1 dose of the COVID-19 vaccine. So definitely what we're seeing in our current data is that if you are fully vaccinated, you have a 4%, if you're not vaccinated, you're 92.9% more likely to get COVID. Or 92.9% of our current cases were not vaccinated. 2.3% of our current cases had 1 dose, and 4.76% of our current cases had 1 dose. I want to take this a little bit further. We can take down the pie chart. Because this next information is even more important. And we have data, these statistics represent the first 42 cases that we've analyzed. We have not yet analyzed the last 9 cases. However, this is 42 cases, the first 42 cases of the 4th wave. So what we do in public health when we identify a positive case is we identify all the contacts. This is not new, we've always done this. What we do differently in Kahnawà than what's being done outside of the community is we ask all of the contacts to be tested, whether they're vaccinated or not. So we have data for all of those contacts who were tested, whether vaccinated or not. And what we've seen, therefore, so for the first 42 cases, we've tested 110 contacts. And of those 110 contacts, 35 of them were doubly vaccinated, 22 of them had 1 dose, and 53 of those were unvaccinated. Now, what the data has shown us is that of the 35 people tested who were considered moderate to severe contacts of a positive case, 2 became positive. This is a positivity rate of 5.7%. 33, therefore, were negative. Of the 22 contacts of a positive case who were tested, one who had 1 dose of the vaccine, 1 became positive, and that's a 4.54% positivity rate. Of the 53 contacts who were tested, contacts, again, moderate to severe contacts of a positive Delta variant case, 39 became positive. That's a 73.6% positivity rate. What this demonstrates to us is that if you are a contact of a positive case and you are unvaccinated, with the data we have at this point in Kahnawà, you are almost 74% likely to actually get COVID, as compared to 5.7% if you are vaccinated with 2 doses. This is a very big difference. That's just for a small group sampling, right? Because we have a small community here and we have a small number of cases. But Quebec is also doing that same analysis, and they've pretty much seen a similar trend. And they're looking at the risk of infection without any vaccinations and the risk of infection or the risk of hospitalization without any vaccination. So I'll give you that information. The data that they have as of yesterday is that your risk of infection with 0 vaccinations at this particular time is 8.2 times higher. Your risk of infection with 1 dose of the vaccine is 3.8 times higher than people who are unvaccinated. Your risk of hospitalization with with no vaccines is 19.2% higher than somebody who is doubly vaccinated, and 3.7% higher if you have only one dose than somebody who is unvaccinated. So this information is really important because it really gives us clear data on the differences regarding infection and risk if you're vaccinated versus unvaccinated. So since we're talking about vaccinations, I'll give you the most up-to-date vaccination rates in our community. So our fully vaccinated, meaning 2 doses, for the 12 to 17-year-olds is at 70% at the present time. 18 plus 2 doses is at 69%. And fully vaccinated, so therefore fully vaccinated, all ages 12 and over, is at 69%. What Quebec is expecting to approve vaccines for the under 12-year-olds shortly. We expect vaccines to be available for 5 to 12-year-olds in the month of October, and for 0 to 5-year-olds in the month of January. So we'll continue to keep you up to date about that. What we do know about the Delta variant at this particular point in time is that our original goals of 75% vaccination rates is not enough to protect us or to provide herd immunity, and therefore we're now looking at much higher rates, closer to the 90-95%, and Quebec has set a new rate at 83%, a new goal for the province, and it's a goal that we should try to achieve as well in order to ensure maximum protection in the community. So very important is to talk about our current level of risk in the community. Why are we at an elevated level of risk, and why are we going to be reviewing measures in the coming week in the community? The first is travel. So as we know, we are able to travel quite easily, and this is bringing our community to a higher level of risk, provincial and international travel, and we've seen in our current cases that I believe 3 of the active cases in the 4th wave were related to travel outside of Kahnawà, mostly cross-border travel. We know that we're at an elevated level of risk with school reopening, so many more children will be in close proximity to each other. We know that there's fatigue leading to a decrease in overall measures and compliance. We're all in this situation at the current time, especially considering that we, had this huge hope that that we were going to get through this pandemic over the course of the summer. There's a change in weather also that's going to lead very shortly to an increase in indoor activities as opposed to outdoor. There's a continued perception of safety in Kahnawà, and the perception that we have a Kahnawà bubble, that if we stay amongst the community that we'll be safe. This perception is actually a risk right now. As I've spoken about, there's an increased risk associated with the Delta variant with respect to its transmissibility and severity. What we see and what we've seen in our own community and what we see elsewhere is that the Delta variant, one person can transmit the virus to an average of 10 to 15 people, as compared to the original strain, which was approximately 5 people. This is a huge risk because it puts a huge strain on our hospital system and our ability to contain outbreaks. Our vaccination rates are low with respect to the needs and the protection that the Delta variant now is showing, and therefore that's a continued risk. We're also seeing that currently with the Delta variant, vaccine efficacy is decreased slightly, and that's why we're seeing more we're seeing some breakthrough cases of COVID-19 in people who are vaccinated. However, these breakthrough cases are for people who have had a prolonged exposure to a COVID-19 case. So either a doubly vaccinated person who lives with somebody who's COVID-19 positive, for example. Somebody who's vaccinated is not expected to get COVID-19 from, going to the grocery store. We do see that that vaccine efficacy is decreased in the face of the Delta variant. Of course, what puts us at risk is also cultural considerations, and we do have full respect for every person's ability and right to make an informed decision for themselves about whether they get vaccinated or not, and that's not the issue in any shape or form. The risk is that we still do have risk in these cultural considerations. So because we have to mitigate the fact that our vaccination rates are lower, and we have to find ways to do that in a safe way. The last risk is what's happening around us. As I pointed out, risks of increased cases, hospital stays, and death is on the rise. And so all of these variables together actually lead to increased risk for the community, and therefore the need for increased measures as well. So despite these risks, we do have the ability and power and control over our environment, and we have to remember that we are still, despite the risks, in a better place than we were last year, because we have knowledge and we know what works, and we know that hygiene measures work. We know that masking works. We know that distancing works. We know that vaccination works. We know that good ventilation works. So we have everything at our disposal to make appropriate decisions to get through this fourth wave, as unfortunate as it is that we have to do so. And despite all these risks, I just want to bring us back to what Lloyd spoke about, which are the goals and the guiding principles that we have, that we really want to keep our kids in school. Another year of off-site learning will have detrimental effects to the long-term well-being of our children. We want to keep businesses open and the economy running, because these are parts of determinants of mental health and well-being, being able to provide, being able to have gainful employment. We want to try to keep the community open as long as possible without going towards a lockdown. Therefore, we want to maintain gatherings. We want to keep people able to visit in safe ways. We want to protect our hospital services, our frontline teams, all of the people who have been working 20 hours, 10, 12 hours a day. I know it's hard to imagine, but it's the truth. People who are giving are really at the end of the ability to continue to do what they're doing, and we need to do everything in our power to protect those people. And in order to do all this, we really hope to use the most minimal measures to achieve all these goals. And so what are the next steps? The next steps are that we will release this information that I presented to you today in writing, because we know that it's a lot to digest, and we want you to have the opportunity to look through it. We also will be organizing, call it a task force meeting next week, where we really discuss what and how we move forward to ensure that the community is protected and that we can meet the goals that we've presented to you today. And in the meantime, we ask that you maintain the measures that you already know so well, and that you make decisions for you and your family that are safe for you, but for the collective as a whole. And we'll be getting back to you with more information. Thank you for being with us today.